Dave, the EU says it's not to blame for the slow rollout. The bloc, however, did wait to start their campaigns together, though. What roles does Brussels play today in what member states are doing on this issue?
Yeah, there are three issues here which I think are being confused. There's the vaccine procurement, the authorization, and then the production and distribution. And while the first two are being done by the EU, the last is being done at national level. It's a national responsibility, and that's where the problems have been over the past week. The problems have really been in production bottlenecks and distribution problems, especially since this Pfizer vaccine, which is the only one approved so far for use in the EU, requires very, very cold temperatures, and that's creating problems in trying to get it stored, transported, and administered. I think what we're having going on here is some domestic politicians trying to blame Brussels for problems that are made nationally. It's a phenomenon we see often in Europe, but of course the Commission didn't help itself here by having a vaccination V-Day 1 week ago where all the vaccinations across the EU were supposed to start at the same time. It kind of gave people the impression that it was the EU coordinating this distribution of vaccines, when in fact that's entirely done at a national level. Now, EU countries are way behind the US and the UK in terms of giving out the vaccine. That's because those other two countries got a big head start because they gave emergency authorizations 2 weeks before the EU gave its conditional authorization. The EU chose to wait 2 weeks longer to give this more thorough type of authorization for two main reasons. One is vaccine skepticism is much higher in continental Europe than it is in the UK and the US, and they wanted to make sure they didn't give people any reason to be more skeptical because of an emergency authorization. And also that emergency authorization will open up the US and UK governments to legal liability if anything goes wrong with these vaccines, which the EU will not have. It'll be the pharmaceutical companies on the hook because they went with this longer authorization. That third issue, procurement, not really the issue here so far because there are enough vaccine doses at the moment secured. What we're seeing in Europe is the same phenomenon we're seeing in the US and the UK, where there is enough supply, there's just as difficulty getting that supply out to people.
Tell me more about the procurement, Dave, because many are indeed saying that the fact that the EU sealed a deal with 6 vaccine contracts, that is having an impact on how many vaccines are available.
Indeed, that's the problem. Right now, Pfizer-BioNTech is the only vaccine approved, and the EU pre-ordered only 300 million doses for 450 million Europeans. And of course, each person needs 2 doses. But the thing is, that 300 million doses is just one order out of a wider portfolio of 7 different vaccines. And the EU actually ordered 2 billion doses across that portfolio. So it's not necessarily a question of not enough vaccines being ordered. It's that they didn't order enough of this first vaccine that's available. But the Commission says that they had to take these decisions over the summer when it wasn't yet clear which of these vaccines were going to pull ahead. And they say people just need to be patient here because eventually more vaccines are going to be authorized, and that's going to solve the supply problem because the Commission has already secured large amounts of doses with those new vaccines. We are expecting the European Medicines Agency to give its approval to the Moderna vaccine today, so that should go some way in helping ease these supply and production issues encountered so far. Although Moderna's production capacity in Europe is limited, I think a lot of people are looking to the Oxford AstraZeneca vaccine approval, hoping that that is going to happen quickly from the EMA because that will help speed things along. Again, the criticism here, I think, is mostly focused on the timing here, that the EMA waited so much later than the other countries. The EMA has its reasons. People can like those reasons or not. But certainly what we're seeing in Germany in particular, there is a leadership contest going on there to replace Angela Merkel. And I think there's a lot of domestic politicking going on here. The Commission is saying, look, we're 1 week into a vaccination campaign that's going to take a year. We're really not going to know the success or failure of this until the spring. People need to be a little patient and keep in mind the vaccines are not going to be a silver bullet here to make things return to normal anytime soon.
Dave, thanks very much for that. Dave Keating there, our correspondent in Brussels.